Hey everyone, and welcome back. Today we're doing a deep dive on something you've probably been hearing a lot about in the news lately.
Yeah.
Walking pneumonia.
It's pretty scary stuff, actually.
It is, and especially with this recent surge in cases, I think a lot of people are concerned.
Right. And I think what's especially concerning to a lot of people is that we're seeing it more and more in younger children.
Yeah, we're seeing this shift in demographics.
Yeah, exactly.
Where it used to be more common in older children and teenagers.
Yeah.
Now the CDC is reporting a spike in cases
Huge spike.
among toddlers, those between 2 and 4 years old.
Yeah, it's really alarming. So let's break this down a bit because I think there's some confusion out there.
Sure.
What exactly is walking pneumonia?
Well, it's caused by this tiny bacterium called Mycoplasma pneumonia.
Okay, so it is a bacterial infection.
Yes, it is.
And why is it called walking pneumonia?
Well, it's called walking pneumonia because the symptoms are often so mild that people don't even realize they're sick.
So they're walking around.
They're walking around, they're going to work, they're going to school.
Spreading it.
Spreading it, exactly.
Unknowingly.
Especially young children.
Yeah.
You know, they might just have like a lingering cough, a little bit of fatigue, maybe a low-grade fever.
And you just think, oh, it's just a cold.
Exactly. You would just think it's a common cold.
And that's part of the problem.
Huge problem.
Because then it just spreads like wildfire.
Yes, it does. It spreads through respiratory droplets when someone coughs or sneezes.
Right. So just like the cold or the flu.
Exactly.
And the incubation period, I was reading about this, it can be really long.
Yeah, it can be as long as 3 weeks.
3 weeks.
Yeah, so for 3 weeks, someone could be contagious without even knowing it.
Wow, that's scary.
Yeah, it's a long time.
It is. So what are some of the things that people should be looking out for?
So if someone does start to experience those mild symptoms, what should they be on the lookout for? Well, unfortunately, the symptoms can really mimic a lot of other respiratory illnesses.
Okay.
So you're looking at things like fever, cough, sore throat, pretty standard cold and flu symptoms.
Right.
And younger children, they might even have some gastrointestinal issues.
Oh, wow.
Like nausea, vomiting, diarrhea.
So it can really run the gamut.
It can.
So if it looks like a cold, feels like a cold, how do doctors even begin to diagnose this?
That's the tricky part.
Yeah.
Diagnosing walking pneumonia can be very challenging because the symptoms overlap with so many other things.
Right.
The gold standard is something called a PCR test.
Oh, okay.
It's highly sensitive and gives us rapid results.
Okay.
But unfortunately, PCR testing is not always readily available.
So if you can't get the PCR test,
right,
then what?
What are some of the things doctors consider? Well,
yeah,
clinical judgment becomes really crucial in these cases.
Okay.
So doctors have to consider the patient's history, how they're responding to any initial treatments, and of course the possibility of other causes for their symptoms.
So it really becomes a process of elimination.
Yes.
Yeah.
It's like piecing together a puzzle.
Yeah.
Especially when we're dealing with mild cases.
Okay, so let's say you get a diagnosis. What are the typical treatment options for walking pneumonia?
Well, the good news is that a lot of the mild cases will actually resolve on their own.
Really?
With just supportive care.
Oh, okay.
Like rest, fluids, over-the-counter medication.
So just basically writing it out?
Yeah, basically just letting the body do its thing.
But for the more serious cases, or if someone's not responding to that kind of...
That initial supportive care.
Yeah, then what?
Then doctors will likely prescribe antibiotics.
Okay, but I'm guessing it's not just any antibiotic.
You're right, there's a catch.
Okay, I knew there had to be a catch.
You remember how we talked about Mycoplasma pneumoniae being this tiny bacterium?
Yes.
Well, it's unique in the sense that it lacks a rigid cell wall, which makes it resistant to some common antibiotics like penicillin.
Really?
So it's almost like this slippery, shape-shifting foe that can evade some of our usual defenses.
Fascinating.
Yeah, so we have to use something a little bit stronger.
So what kind of antibiotics do work against it?
Well, typically doctors turn to a class of antibiotics called macrolides.
Okay.
Like a zithromycin.
Okay, and is this where the antibiotic resistance comes in?
Yes. Unfortunately, the overuse of these macrolide antibiotics has led to increasing resistance.
That's what I was afraid of.
Yeah, it's a big problem.
And it really highlights this need for...
responsible antibiotic use.
Yeah.
Completing the full course of antibiotics that are prescribed, not demanding antibiotics for viral infections, things like that.
So it's this balance we have to strike.
We do.
Between treating this infection and also making sure that we're not contributing to a bigger problem down the road.
Exactly.
Now, speaking of the body's defenses, I want to talk about neutrophils for a moment.
Sure.
Because I was reading about how they can be a little bit of a double-edged sword.
They can.
when it comes to walking pneumonia. So can you explain that to our listeners?
Of course. So neutrophils are these essential immune cells. They're like the frontline soldiers, right?
Okay.
And in the case of walking pneumonia, they're attacking Mycoplasma pneumoniae in a few ways.
So they're the good guys, right?
They are. But here's the thing.
There's always a but.
There is.
Okay.
So while they're fighting the good fight, right?
Yeah.
They're also releasing all these powerful chemicals that can cause inflammation.
Ah.
So it's kind of like using a grenade, effective.
Yeah.
But there can be some collateral damage.
Right.
And in the case of walking pneumonia, if that inflammatory response gets out of control,
Yeah.
it can actually damage the lungs.
Oh, wow.
So it's like in their attempt to fight the infection,
Yeah.
they might inadvertently be causing further harm.
That's kind of scary.
It is.
I can see why this would be especially worrisome for younger children and older adults.
Exactly. They're more vulnerable to those complications from that excessive inflammation.
Because their immune systems are either
not fully developed or
not as robust.
not as robust. Exactly.
So this is definitely something that researchers are
actively trying to
figure out.
understand and address.
Okay. So while they're working on that, what can we do?
Right.
What can we do to protect ourselves and our families?
The good news is a lot of this is stuff that we should be doing anyway.
Right.
Especially during cold and flu season.
Yeah.
So frequent and thorough hand washing.
The basics.
The basics, that's paramount.
Yeah.
And don't forget to cover those coughs and sneezes.
Yes.
Ideally into your elbow, not your hand.
Right.
Yeah.
Good old-fashioned hygiene.
It really is.
It's amazing how those things get overlooked.
It really is.
And then, of course, avoiding close contact with people who are sick.
As much as you can.
Easier said than done.
Especially with young children, right?
Especially with kids.
Yeah.
So speaking of young children, because we are seeing this spike in toddlers,
Yeah.
what should parents and caregivers be looking out for?
Well, I would just say for parents, vigilance is key.
Okay.
Be extra attentive to any respiratory symptoms in your young children,
Yeah.
especially those under 5.
Okay.
Don't hesitate to contact your healthcare provider if you notice a persistent cough, a fever that isn't breaking, or any difficulty breathing,
Right.
especially if those symptoms are worsening
Or just not improving.
or just not improving.
Yeah.
Early intervention is key.
Absolutely. Now, before we wrap up, I did want to touch on something that we came across in our research for this deep dive.
Okay.
And that's this herbal formula
Okay.
that's said to be helpful for walking pneumonia.
Interesting.
It's mentioned in the Lost Book of Herbal Remedies.
Okay.
And it seems like a lot of people are curious about it.
Yeah, I see why.
Yeah.
It's got quite a following.
It does, and it includes several herbs, each with its own kind of purported benefits.
Uh-huh.
We're talking about andrographis, licorice root, elderberry, echinacea, ginger.
Oh, wow. Those are some good ones.
So right off the bat,
Yes.
we want to emphasize that we are not medical professionals.
Correct.
This is not medical advice.
Always consult with a qualified healthcare provider
Always.
before trying any new treatment, especially when it comes to herbal remedies.
Absolutely.
Herbs can interact with other medications, and they're not suitable for everyone.
Definitely talk to your doctor before trying anything new.
Yes.
With that disclaimer out of the way, I think it's still interesting
Of course.
to explore some of these traditional approaches,
I agree.
just for informational purposes.
For sure.
So can you tell us a little bit more about some of the herbs in this formula?
Yeah.
And why they're thought to be beneficial for walking pneumonia?
So, for example, andrographis. It's known for its antibacterial and antiviral properties, which make it popular for supporting the immune system during infections.
Interesting.
And then we have licorice root,
Uh-huh.
which is often used to soothe the respiratory tract and ease coughs,
Okay.
which could be helpful for that persistent cough that often comes with walking pneumonia.
Right.
And then there's elderberry, which seems to be everywhere these days.
I was just going to say elderberry. It's like the new...
It's like a rock star.
It is.
It is.
And it has gained a lot of attention for its immune-boosting potential.
It has.
And some studies even suggest that it might help reduce the severity and duration of respiratory symptoms.
Yeah. So that's promising.
It is. And then, of course...
We have echinacea and ginger.
The classics.
The classics, you're right. It feels like they're in every cold and flu remedy out there.
Exactly. And there's a reason for that.
There is.
Echinacea is believed to enhance the immune response.
Yep.
And then ginger.
Ginger's great.
It's warming. It's anti-inflammatory.
It can act as an expectorant, helping to loosen mucus, soothe a sore throat.
So many benefits.
It's a multitasker.
It is. So it seems like this formula is addressing a lot of the key aspects.
Yeah, supporting the immune system.
Yeah.
Easing symptoms.
Yeah.
Potentially even helping to fight off that infection.
Yeah, but again, big but.
We have to remember that the effectiveness of herbal remedies can vary widely depending on the quality of the herbs themselves.
Sure.
The specific formulation, individual factors.
Right. Everyone's different.
Everyone's different. And it's also really important to source your herbal products from reputable companies.
Absolutely.
To ensure both safety and quality.
You don't want to just be buying something off the internet from who knows where.
Exactly. Do your research.
Do your research. That's a good point.
And consult with a healthcare professional to determine if that particular herbal formula is right for you.
Right. So we've covered a lot of ground today.
We have.
We've talked about the basics of what walking pneumonia is, how it spreads.
We talked about
diagnostic challenges.
Treatment options.
Yeah. Preventative measures.
We even got into the herbal approach.
We did, and we'll continue this conversation in part 2.
Yeah, this is a lot to unpack.
It is.
But it's a really timely and relevant topic.
It is. So we'll be back with part 2 soon.
Looking forward to it. So much to talk about with this walking pneumonia.
There is. It's really fascinating.
It is.
And I think it's one of those things that people don't really think about until
it affects them.
Until it affects them or their kids or, someone they know.
Exactly.
And then suddenly it's like, oh, wait a minute.
What is this?
What is this? I need to know more.
Right.
So
we're here to give you the information.
That's what we're here for. So we've been talking a lot about, the bacteria itself, the symptoms, the treatment. But I want to circle back to this idea of prevention.
Yes, prevention is key.
Because ultimately,
it's always better to prevent than to treat.
It is. And especially when we're talking about something like walking pneumonia, where the symptoms can be so mild.
And easily spread.
You might not even know you have it.
Right.
So what are some things that people can do?
Well, a lot of it comes down to those good old-fashioned hygiene practices.
Okay. Give us the rundown.
So things like frequent hand washing.
The basics.
The basics, yeah. But you'd be surprised how many people don't wash their hands properly.
It's true.
Or often enough.
You see it all the time.
You do. And it's like, come on, people.
It's like the easiest thing you can do.
It is. It's like the first line of defense.
Exactly.
So hand washing, covering those coughs and sneezes.
Into your elbow.
Into your elbow. Yes, not your hand.
Not your hands.
Because then you're just touching everything.
Exactly. And then you're spreading it.
Spreading the germs. Exactly.
So those are the basics.
The basics. And then also try to avoid close contact with people who are sick.
Yeah, I mean...
Easier said than done sometimes.
It's not always easy, especially if you have kids.
Especially with kids in school, daycare, they're germ magnets.
Yeah.
But, if you can, try to keep your distance from people who are coughing and sneezing.
Absolutely.
And if you're sick, stay home.
Yes, stay home.
Don't go to work, don't go to school, don't go to the grocery store.
Spread the love, not the germs.
Exactly. Spread the love, not the germs.
I like that. We should put that on a t-shirt.
We should.
So those are some good preventative measures.
Yeah. And I think it's really important for parents especially to be extra vigilant when it comes to their kids.
Especially with these younger kids.
Especially those under 5.
Yeah.
Yeah, because their immune systems are still developing.
Right.
They're more vulnerable to these kinds of infections.
And we were talking earlier about how the symptoms can be so mild.
Yeah, it can be really hard to tell.
It can be hard to tell if they're just being a little fussy or if they're actually sick.
Or if it's something more serious.
So what should parents be looking for specifically?
So if you notice a persistent cough, a fever that's not breaking, any difficulty breathing, don't hesitate to reach out to your healthcare provider.
Right.
Early intervention is key.
Yeah. You don't want to wait until it gets really bad.
Exactly. And sometimes it can be hard to know.
It can be hard to know.
But trust your gut.
Yeah.
If you're concerned, it's always better to err on the side of caution.
Absolutely.
And get checked out.
Okay, so we've talked about prevention. We've talked about what to look for in your kids.
Yeah.
Now I want to talk about...
What else is there?
This herbal formula.
Oh, yeah, the herbal formula.
That's been making the rounds.
The one from the Lost Book of Herbal Remedies.
Yes, and again...
Big disclaimer.
Big disclaimer.
We are not doctors.
We are not medical professionals.
This is not medical advice.
Please consult with a qualified healthcare provider before trying any new treatment.
Especially when it comes to herbs.
Especially herbs, because they can interact with other medications.
They can?
And they might not be right for everyone.
Right, so talk to your doctor.
Talk to your doctor first.
Always.
But I do think it's interesting.
It is interesting.
To explore some of these traditional approaches.
I agree.
So let's dive into this formula a little bit.
Okay.
So it includes a bunch of different herbs.
It does.
And each herb is said to have its own specific benefits.
Right.
So let's start with andrographis.
Okay, andrographis.
What's the deal with that one?
So andrographis is known for its antibacterial and antiviral properties.
Okay, so it's kind of like a double whammy.
Yeah, it's like a 1-2 punch.
It's coming at you from both sides.
Exactly, and it's often used to support the immune system during infections.
Interesting.
So it's like giving your immune system a little boost.
Okay, and what about licorice root?
Licorice root, that's a good one.
I love licorice.
It's so soothing.
It is. I used to eat those licorice whips all the time as a kid.
Oh yeah, those are good.
But this is a different kind of licorice, right?
Well, it comes from the same plant.
Okay.
But it's the root that we use medicinally.
Okay.
And it's often used to soothe the respiratory tract.
Okay.
And ease coughs.
Which makes sense.
It does.
If you think about it, because licorice is already so soothing.
Exactly.
So it's kind of like a natural cough suppressant.
It can be, yeah.
And then we have elderberry.
Elderberry. The superstar.
The superstar, right?
It's everywhere these days.
It's like you can't go anywhere without seeing elderberry something.
Elderberry gummies, elderberry syrup, elderberry lozenges.
Elderberry everything.
Everything.
And there's a reason for that.
There is, because it's packed with antioxidants.
Uh-huh.
And it's been shown to have immune-boosting properties.
And it tastes good.
It does. It's got that nice tart flavor.
Yeah, so that's a win-win.
Win-win for sure.
And then we've got the classics.
The dynamic duo.
Echinacea and ginger.
Oh, yeah. Those are like the staples of any cold and flu remedy.
I feel like they're in everything.
They are.
Yeah.
And for good reason.
They work.
They do.
Echinacea is believed to enhance the immune response.
Okay.
And ginger is just amazing.
It is. It's so versatile.
It is. It's warming. It's anti-inflammatory. It can act as an expectorant, which helps to loosen mucus.
Yeah.
And it can also soothe a sore throat.
So many benefits.
It's a multitasker for sure.
It is. So it seems like this formula is really hitting all the key points.
It is.
Supporting the immune system.
Yeah.
Easing symptoms.
Yes.
Potentially even helping to fight off that infection.
Right. But, again,
big but,
we have to remember that the effectiveness of herbal remedies can vary widely.
Of course.
Depending on the quality of the herbs themselves.
Sure.
The specific formulation, individual factors.
Right.
Everyone's different.
Everyone's different, so it's really important to source your herbal products from reputable companies.
Yes.
To make sure that you're getting a quality product. Absolutely. You don't want to just be buying something online from who knows where.
Right. You want to do your research.
Do your research.
And talk to your healthcare provider.
Yes, always.
To make sure that it's right for you.
For sure.
Okay, so we've talked about prevention. We've talked about some natural remedies. What else do we need to know about walking pneumonia?
Well, I think one of the biggest challenges we're facing right now is antibiotic resistance.
Yeah, we talked about that a little bit earlier.
We did.
But I think it's worth diving into a little deeper.
It is.
Because it's a serious issue.
It is a serious issue.
And it's something that we all need to be aware of.
Absolutely. And I think a lot of people don't realize how big of a problem this is.
It's a global problem.
It is. It's not just something that's happening here in the U.S.
It's everywhere.
It's a global crisis.
Wow.
And it's really a race against time.
Because the bacteria are evolving?
They are. They're constantly evolving.
Faster than we can develop new antibiotics.
That's the scary part.
And so we're kind of in this situation where we're running out of options.
We are. And that's why it's so important.
Yeah.
To use antibiotics responsibly.
Yes. I think that's the key takeaway here.
It is.
It's not about never using antibiotics.
Right.
It's about using them appropriately.
Exactly.
And making sure that
we don't contribute to this problem.
Not the problem of resistance.
Exactly.
So what does that look like in practice?
So it means only taking antibiotics when they're truly necessary.
Okay.
Not pressuring your doctor to prescribe them if you have a viral infection.
Because antibiotics don't work on viruses.
They don't.
That's important to remember.
It is. And when you are prescribed antibiotics, make sure you take the full course.
Even if you start feeling better.
Even if you start feeling better.
Yeah, that's a big one.
It is, because I think a lot of people...
They start feeling better and they're like, okay, I'm good. I don't need these anymore.
Yeah.
But it's so important to finish the entire course.
To make sure that you've killed off all the bacteria. Exactly. Otherwise, you're just contributing to the problem of resistance.
Right, because the bacteria that survive, they're the ones that are resistant.
Exactly.
And then they can multiply.
And spread.
And spread that resistance.
It's a vicious cycle.
It is. So it's really about...
Being mindful.
Being mindful, yeah.
And taking responsibility.
For our own health.
Yes.
And the health of our community.
And the health of future generations.
Yeah, because this is something that's going to affect us for years to come.
It's not going away anytime soon.
No, it's not, so we need to be smart about it.
We do.
And education is key.
Education is key, yeah.
We need to be talking about this more.
Absolutely.
We need to be raising awareness.
And not just among patients.
Right, healthcare providers as well.
Healthcare providers, policymakers.
Everyone.
Everyone needs to be on the same page.
We need to be working together to combat this problem.
I think that's a good segue into our next topic.
Okay.
Which is, what can we do?
Right. On a bigger scale.
On a societal level.
To address this issue of walking pneumonia.
What can we do to move the needle?
Yeah, what can we do to move the needle? Because we've talked about individual actions.
Right.
But what about collective action?
Yeah. What can we do as a community?
As a society.
To make a difference.
To make a difference. So I'm curious to hear your thoughts on that.
I have some thoughts.
Let's hear them.
Well, I think one of the most important things we can do is raise awareness.
Okay.
I mean, we've talked about how easily walking pneumonia can be mistaken for a common cold.
Yeah, and how that can lead to delayed diagnosis.
Exactly, and that can increase the risk of complications.
And also give the bacteria more time to spread.
Right, so we need to get the word out.
So how do we do that?
I think public health campaigns could play a big role here.
Okay.
You know, we need clear, consistent messaging from public health organizations and healthcare providers.
Like public service announcements?
PSAs, yeah, pamphlets in doctors' offices.
Social media campaigns?
Absolutely. Anything we can do to get the word out.
To help people understand.
What walking pneumonia is.
Yeah.
How it spreads.
Potential complications.
And the importance of early detection.
And seeking care when needed.
Exactly.
And I think it's also important to remind people about those basic hygiene practices.
Oh, absolutely. Those are crucial.
You know, hand washing, covering coughs and sneezes properly, staying home when sick.
Those things can make a huge difference.
In breaking the chain of transmission.
Absolutely.
It's like the seatbelt analogy, right?
I love that analogy.
It took years of public awareness campaigns and even laws to make wearing a seatbelt second nature.
Right.
And we need that same level of commitment when it comes to these basic health habits.
I agree. It's about making it a cultural norm.
Yeah.
So that everyone's doing their part to prevent the spread of infection.
And I think another important piece of this puzzle is empowering patients.
Absolutely.
To ask questions.
Yes.
And have those open conversations with their healthcare providers.
It's about shifting the dynamic.
Yeah.
From patients demanding antibiotics to patients understanding when they are and are not necessary.
Right. And doctors need to be on board with this as well.
They do.
You know, prescribing antibiotics only when truly needed.
Absolutely.
And with clear instructions on how to take them responsibly.
That's key.
So it's a two-way street.
It is.
Both patients and healthcare providers have a role to play.
In ensuring that these life-saving medications remain effective for years to come.
Absolutely. Well, I think we've given our listeners a lot to think about today.
I hope so.
We've covered a lot of ground.
We have.
From the basics of walking pneumonia to the diagnostic challenges.
The treatment options.
The preventative measures.
And even the potential role of herbal remedies.
We did, and we also touched on some of those bigger picture challenges, like antibiotic resistance.
And the importance of prevention.
And public health education.
It's been a really interesting conversation.
It has, and I think it's a conversation that we need to keep having.
I agree.
Because this is an issue that's not going away anytime soon.
And it's something that affects all of us.
Absolutely. So to our listeners, thank you for joining us on this deep dive into walking pneumonia.
Yeah, thanks for listening.
We hope you found it informative and empowering.
And we hope you'll continue to stay curious.
Stay informed.
And stay well.
We'll see you next time.